Hello, and welcome to Inspiring Women in Canada. Our guest today is Amna. She's a registered psychotherapist with Center of Healing Minds, and she's going to talk to us today about mental health services. So, Amna, thank you so much for joining us here today.
Thank you for having me, Rima.
Now, I was hoping before we get into the type of services that are offered, you could tell us a little bit about yourself and how you got to the point that you are at today.
Okay, so Rima, I was born in Canada. My parents, they immigrated from Pakistan. And then, I moved to Middle East as a child. I did my schooling over there. And then after that, I lived in Pakistan for a couple of years there. That's where I started my practice as a clinical psychologist. I worked there in a hospital setting. And then, while I was pursuing my PhD degree towards clinical psychology, we decided that, we're going to move back to Canada. Yeah, so after that, the initial few years, I took care of my kids. And, after that, once my children were ready to go back to school, I decided that, let's start, my career again. So after that, I did, upgraded my education. I had to complete a few, requirements that are required for, registering yourself with the CRPO, which is College of Registered Psychotherapists of Ontario. Okay. So after getting my license and upgrading my education, I started working in the field of mental health and working in different agencies. And then, after a few years, my husband was like, why don't we start our own practice? It's that, we have vision, we want to help people. There are a lot of problems in our, society, and people are looking for, counselors and, therapists who belong to their own cultural background. So after that, he said that, okay, he's going to support me with he has a background of marketing and sales. So he said that, he's going to take care of all the operations there, and while I can, look at patients. So that's how, Center of Healing Minds started. And, it has been going really well. Since then, we have a lot of people coming in and, a lot of, people with different issues. We help individuals, couples, families, going through different issues.
So you were practicing in Pakistan also?
I was working there in a hospital setting.
Okay.
And, while I was practicing, then I decided that, let's pursue my PhD degree, because education is never wasted, right?
Right.
So it's like, let's further upgrade my education. And that's when, we decided that, okay, let's move to Canada.
Oh, gosh.
Yeah.
So you're a small business owner as well as being a registered psychotherapist.
Yes.
So you wear several hats.
Yes. So so we're expanding as well. Okay. We hired a few counselors to work with us, and it's been going good so far. And we're also in the process of piloting a few support groups for women. That would actually help them sit with people who are like-minded and talk about depression, different issues. So that's still in the process. So if anyone is interested, they can definitely go on our website or call us to.
So support groups, is that like group therapy or is that different?
It's different. So we have we're piloting anger management groups to help people manage their anger levels and be more aware of what's happening with them. Whereas there's also a group for depression where people can talk about issues. They can also learn about different techniques and therapies, which is cognitive behavioral therapy, that basically works on your thoughts, which affect your emotions. So once people are more aware of what's happening with them, they are in a better position to control their behavior. So that's what's very important, that they're more self-aware of what's happening with them. And that's what psychotherapy aims to do, that be more self-aware, identify your triggers, and after that, what are the coping mechanisms we can use and what would work in different situations.
So that's interesting you say coping mechanisms, so sort of healthy coping mechanisms as opposed to, say, drugs or alcohol or something.
Exactly. So It's like, the choices you're making. So don't take life, as it's coming to you. You basically choose how you want to be. And
so it's about how to deal with it. You're not curing anything or making things go away or anything, but dealing with the issues.
And the thing is, in psychotherapy, we give the client, that part where, they can choose themselves of what behaviors and what things would work for them. So that in future, whenever they have an issue, they can themselves control it. They won't need their therapist all the time to solve their problems. So therapy basically works on helping them, get equipped with all the necessary skills that are required to function, in everyday life.
So it's not like once you start therapy, you're doing it for the rest of your life.
So once you start therapy, you're just aware of like what's happening with you, and then it would help you for your whole life. So initially, for example, if a client comes in, they have issues of social anxiety, it's important to recognize like, why are they having social anxiety? Is it because of low self-esteem? Is it because of an abuse happening in a relationship, or any other reason? So once we identify that, then we would be working on that particular area. So for example, in the first session, we would be making their goals, that, what's happening with them. They themselves choose that, these are the areas I want to work on. And, then the therapist helps them identify that, this is what, we can come up with.
So if someone's never done therapy before and they come in for the first session, how many sessions are they looking at? What determines that?
So it's, again, it varies from person to person. It depends on what condition the person is coming. So for example, if a person is clinically depressed, obviously that would require more work, so more sessions. Whereas if someone is just coming and they're saying that, we just need a quick solution for our problem, so we'll do a short-term therapy for them, that would be like 4 or 5 sessions. Whereas if someone is coming just to learn CBT, that would be 8 to 12 sessions. If a couple is coming, even they would, based on their relationship. Like, for example, most of the times couples come when, it's just that their relationship is at the verge of a divorce.
Yes.
So at that point, we, usually, it would require more work. Whereas, compared to a couple who has been married for like, 1-2 months, they're having problems. So the earlier you come,
Yes.
the better your chances are to, heal yourself.
Because sometimes people might feel that they've tried everything else, it hasn't worked,
Yeah.
and now they'll try therapy.
Right.
But you're saying that they should try it earlier.
Yes.
Okay.
So because sometimes, like, for some clients, they feel like, okay, we don't want to start medication, we want to start therapy first, so let's give it a try. Some people, they do it side by side. Again, it's a personal choice. People make their choices themselves. And the choices you will make, obviously, you would see the results.
So speaking of medication, can you talk about the role of prescribing medicine, psychiatry versus psychotherapy?
So psychiatry, that's a completely different field. Like medical doctors, like they're specialized in the field of psychiatry. They usually, they work with, with mental health, and they prescribe medication. So if a person is coming in for issues of anxiety or depression, they would prescribe medication, or they may also say like, why don't you start therapy first and then come back, if it's not working. So again, like, a psychiatrist works with that perspective, whereas psychotherapy, it's more towards, psychological treatments. There are a variety of psychological treatments. Every therapist, they have their own style. Like, for example, I use eclectic approach. It's based on the best interest of the client, and we use different variety of techniques for that. So I predominantly use CBT, which is cognitive behavioral therapy, working on thoughts, which would change your emotions. So emotions cannot be changed unless you change your thoughts, right? So the person identifies like what kind of thoughts he or she is having, which is creating those emotions, and in turn have an effect on behavior.
And CBT is actually one of my personal favorites. I think it just suits my personality, because I feel at the end of the sessions, the therapist gives you behaviors to try.
Right.
And so I feel like, okay, I've been given some homework and I can go do something.
And usually, I don't call it homework because I don't want them to go back to school.
Yes.
I always call them that, okay, it's a self-development project that, we're going to, this is your project, you're working on your personality. So yeah, so let's work towards it, and every time after the session they have those homeworks, which we call in CBT,
Yes.
and they go back home and try whatever they learned in their world outside, and then come back with different changes they have made and how it had helped them.
Now, you mentioned psychiatry is more like a medical doctor. So
Yes.
they go to medical school, they do the residency, they do all that. But that's not psychotherapy.
No.
So can you talk about what it is required to be registered with the College of Psychotherapists in Ontario?
So basically, psychotherapy, it's a controlled act. So not anyone can practice psychotherapy. There are a few colleges which regulate this profession. So the purpose of being registered with a college is because a person knows, the college actually protects the public interest, right? So a person who's coming to a therapist, they know that they are well trained, they have the necessary skills, and the colleges, it's like they're keeping an eye on, what the registered psychotherapist practices are. So that's why that actually helps a person who's coming in for the first time know that, okay, I'm in a safe place, this person is registered, I can trust him, and that's how the work is done.
And you have some of the duties that you have. One of them is confidentiality.
Right.
So can you talk about that?
Yeah, so confidentiality is really important in our practice. We make sure that, whatever a person tells us in the session, it's strictly confidential. It's a safe zone. And their information would not be leaked in any case. However, we do inform, our clients in the beginning that, we would respect confidentiality. We do sign a document for that. But there are 3 cases in which we break confidentiality. Number 1 is, if a person is harmed to himself or someone else, in that case, obviously we'll have to report. And if a child under 16 years of age is in severe physical harm, in that case, we also have to report to the Children's Aid Society, or if they're going through a court proceeding and their files are required by the court. But in any case, we always inform them that, we're taking this step. They can trust us that, that their information is completely secure. They don't have to worry. It's a non-judgmental place, and that's why people feel safe to open up.
And if those duties of confidentiality are violated, then you could risk losing your license, right? Or
yes,
being registered.
Exactly.
Yes.
So that's the main point, because like I said, that the college, it protects the public interest, right? So that's why all of their information, it's completely secure.
And how many years have you been practicing?
So I've been practicing for 12 plus years.
Oh, wow.
Yeah, it's been a long time.
Yes.
And that's why, when we were starting our private practice, we were thinking of, expanding and working into different areas to help people understand that, mental health, it's not a stigma. They need to be open about mental health. People are talking more. Media has played a really important role recently. People like insurance companies, they support, they have that in their coverage plan. And a lot of people are not even aware that, these services are covered. Yes. So if you're seeing a registered, professional, your services would be covered through your insurance company. Again, always check with your insurance company, but most of the services are covered.
And they are for people who are licensed?
Yes.
Yes, okay.
Yeah.
We're going to go to a short break, then we'll come back because I have many more questions for
Okay.
you. So we will be right back to continue our discussion with Amna Khan about mental health services. Thank you.
Injuries not only impact you, but also people around you. Life is better than this. Let's get your life back. The injury lawyers at Alam Law will use their years of experience to handle your claim so that you can focus on your recovery. And remember, you don't pay until we win. Alam Law.
everyone, welcome back to Inspiring Women in Canada. Our guest today is Amna Khan. She's a registered psychotherapist with Center for Healing Minds, and we're talking about mental health services today. So Amna, one question I forgot to ask you in the first segment was, if somebody does come for the first time, should they expect to come every day, once a week, once a month? What is normal?
So usually, initially sessions are held once a week. Again, it depends on the condition of the client. So if they're severe, we would be constantly seeing them once a week. But if their condition improves, then we would give a gap of 2 weeks and then gradually put it to once a month until they're ready to handle things on their own. So again, it varies from person to person. Sometimes some clients have their own will that, okay, I just want to do once a month. So we respect that, and we provide them with what they are actually looking for.
And the first session is how long, and how long are follow-up sessions?
So first session, all sessions are basically 50 minutes to 1 hour long.
Okay.
So it's quite some time to work on different skills. The first session is basically an assessment of what's happening. It's more about history taking and setting up goals for therapy, and the work starts in the second session.
Now you talk about the work that's starting. So the communities that you deal with, the immigrant community, and obviously here we're in Canada, what sort of issues do you see? What types of patients are you helping?
So like I said before that, we see couples, individuals, so every person has their own issues. So if we talk about couples, so couples who come in, they're having issues in their relationship. For example, because of finances, the husband is not coming home, so wife is having issues with spending more time, and it's creating a lot of frustration in the relationship, which is why it's affecting children. So then they decide that, okay, we need help. Many times people don't even realize that they need to come in unless things become really bad. So that's why I always advise people that the earlier you come, the better it is, and that's what we aim for. Whereas if you talk about individuals like new immigrants, it depends on how many years they have been in Canada. So if it's the first, second year, it's mostly based on they're looking for motivation, they're looking about education, about how to handle things, how to handle their triggers, because obviously it is stressful.
Yes.
That you're coming to a new country and everything is new. And I always say that it's just a fresh start, and you move to any new country, it's from scratch.
Yes.
Right? So it would take you some time to settle. So once they, start understanding and they're able to handle their emotions related to that, I always encourage clients to stay in their present moment, because the past has been gone, the future has not been here, but you're actually affecting your present moment by thinking about tomorrow.
Okay.
Right? So encouraging them to practice more mindfulness, that is staying in the present moment, so that they can make the necessary adjustments, because this present is going to become your tomorrow.
Now, when you say that it's better the earlier they come, most couples that I know and nobody's relationship is perfect, right? Usually one of them is willing to go to therapy.
Yes.
And it doesn't always the man or the woman. I've seen both cases.
Right.
And usually the other partner says, I don't want to go, the therapist will tell me it's all my fault.
Yes.
What would you say to that person?
So usually you're right about that,
Yeah.
that usually it's one partner who brings in, unless both of them make a combined decision that we need to go. That's the best part, that both of the partners are ready. Whenever a client calls me in, I always ask them that, is your partner ready to come in for counseling? And they're like, okay, I have to convince them. But I always tell them that, if only one partner makes the necessary changes, it can greatly affect the relationship.
They could come on their own?
You can come on their own,
okay.
right? So you can come on your own. You would learn the necessary skills that are required to open up that communication. For some partners, they think that if we start and our partner sees those changes, maybe one day they would be ready to come in too. So they come with that approach. So that's why you don't need to depend on your partner to come in. You can come by yourself, learn what's happening to you and what changes you can make in the relationship, so that once you go home, you apply those changes, and then it works.
And have you seen that sometimes the second person doesn't come, but over time that they do agree to come?
It has happened.
It has happened. That's excellent.
Yes. Yeah.
And then do you see issues, I mean, what if they have children, adolescents, what issues do you see with regards to that?
So adolescents, usually they come with issues of social anxiety.
Okay.
They struggle with, feelings that social pressure. For some, they have issues of past bullying, which is why they're not able to, move into that social pressure. And again, high school is difficult for most adolescents. It's a complete change of environment, so that's why it's important that they work on their self-esteem. So when we work on their self-esteem, they identify what kinds of behaviors they are, showing that is a sign that it is affecting their relationship with other people. So again, it's more about self-awareness, them identifying that these are the things which are problematic. I need to change these because change is necessary for to see results.
Right.
You've continued to live your life for so long, so because you're not seeing the results, so now it's time that you change the way you're doing things.
So do you also do sort of family counseling, like the parent-child relationship
yes,
as well?
Family counseling. It's very broad.
Okay.
Sometimes people come with having issues with in-laws, and I've seen like mother-in-law, daughter-in-law coming together,
Okay.
and all kinds of different family, mother-child, and a child is committing committed
Yeah.
suicide, and parents then coming together with the child to help them understand how we can support our child and what the child's needs are. So in the session, the child knows that, okay, this is a safe place, I can talk about it, and the therapist helps to escalate the process and tell them that what's improve their communication. So that's how family therapy, it's very broad. People see an issue, they come for help, and that's when issues are resolved.
What about an individual coming to you? Can they get any therapy with regards to issues at work?
Yes.
Okay.
So issues at work, again, the same thing, that we would make an assessment that why are things happening at work in a certain way. A person may think that everyone at work, they're not treating me right. So identifying that what are you doing? Like, is it just your own thought that this is happening, or do you have evidence against that thought? So we help them identify that are you the only one who's experiencing, or everyone at workplace is experiencing the same issue? So it's like therapy. It's helping you identify what's happening, or is that the case? Again, I always tell my clients and everyone that we live half of our life inside our mind, and it needs to be a happy place. You need to be peaceful. The way you would feel inside, that's how you would perceive the world. So it's important that we have mental health, and we give importance to it, because whenever someone has pain in the body, they immediately visit the doctor. But if a person is going through stress, depression, they feel like, okay, we can deal with it because it cannot be shown. But a person who is dealing with it, they know that what their life has become. And people consider that death, it's the greatest loss, but a real loss is when you die from inside.
That's true. It's just a wasted life almost.
Right.
And there's a stigma against getting treatment because, oh, it must mean I'm crazy if I'm getting therapy. But it's not. It's just teaching. I mean, the way I see it, you're teaching healthy coping mechanisms.
Exactly.
So out of curiosity, do you also have like elderly immigrant patients?
Yes. So
What are issues that they need? Yeah.
Right. So a lot of times, the elderly, they come and live with their family. They have difficulty in adjusting, probably because of the weather conditions and loneliness. They have those issues, and their children bring them. They themselves don't know about the services, so their children bring them that my mom or dad, they're crying, and they're having these issues. We don't know how to handle them. So they come in, obviously, because they come from a time when mental health was considered a stigma. So
Right.
they have that issue that, okay,
Yes.
my child is taking me to a therapist and, do I have issues? But, I always tell them that, coming to a therapist doesn't mean you have issues. It means that you're ready to make changes in your life. And your information is confidential, so which means that this is just between you and me.
Nice.
No one else would know that you're coming here. But again, you will leave here with skills that are necessary for your growth.
So if I say I'd never had therapy before, but I was dealing with stress, so what would you recommend that I'd look for in terms of a therapist?
Again, it varies of, what people are comfortable with. For some people, they want someone from the same cultural background, they would understand us, and, they would help us deal with it. For some people, they're looking for specific languages that, okay, this is what I need. Some people, again, it's personal preference that what you're looking for, what kind of treatment you need. Now, with time, people are more aware of what treatment options are available. So, you can always see what therapies a person specializes in. So like, this is what I need. I need to work on meditation. So yes, so this therapist, he provides meditation. I need to work on CBT. So this therapist specializes in that. So they choose their therapist based on that.
And how would I know if they're registered with the college?
Usually every profile tells us we have a license number
Okay.
whenever we tell that we're registered.
Okay.
No one can write down that they're registered unless they're actually registered.
And I imagine I could probably go on the college's website and look
Yes.
up
So
your
the
name
college,
and you would
yes,
be there.
So the college has all the information you need. You can just search by name, by license number, whatever. You can always go there and search it yourself. Again, colleges, they do constantly check what their members are doing. Every year there's an evaluation
Oh, wow.
of, about what you have done to improve yourself, how are you maintaining records, and, discussing different venues. So that, helps the members itself that, know that, okay, there is a back over there and the public is protected.
So your Center for Healing Minds, can
Yeah.
you sort of talk a little bit about its location and focuses?
So we're located in Mississauga, in the heart of Mississauga. It's very close to Square One. It's inside the Sussex Centre building. That's the only pink building over there.
Yes.
So we're located there, and we're looking to expand to different cities as well, because we get a lot of demand from different cities, and people have traveled from there.
And parking.
Right.
Yeah.
And people travel from different cities, so that's why we know that there's a lot of need of people from similar backgrounds over there as well. So we make sure we want to make sure that those needs are catered. We're gradually expanding, and we're looking forward to expand in those cities as well.
And is it Monday through Friday or?
So it's open on weekends as well, on
Okay.
Saturday, and Monday to Friday on weekdays. We do have evening appointments,
Okay.
so it's more flexibility, and clients can book themselves as well, and they can call us, and we can provide a time slot.
And are you targeting any, focusing on any specific type of therapy or clientele?
So the clients, we have everything like listed there. We provide different areas where we work on. We treat depression, anxiety, and different mood disorders, child and adolescent issues, behavioral problems, and elderly issues, workplace problems. So it's all listed over there as well. And the clients, they come from a variety of different cultural backgrounds. It's whatever you're looking for, the therapist makes sure that their needs are catered.
And I believe you also provide therapy in several languages, correct?
Yes, so
Yeah.
I speak Urdu, Hindi, and Punjabi, and English. Yes.
Okay, so if somebody is not comfortable in English, they're not denied from getting therapy.
Yes, I speak Urdu as
Okay.
well. So yes, so I do provide therapy in that.
Okay, well, that's great to know. I keep asking you many more questions, but I'm going to have to wrap it up here. But I did want to thank you for coming and helping increase awareness of the mental health services that are available.
Thank you to you too for having me here, and it was a pleasure speaking to you.
Oh, great. Thank you. So thank you for joining us. That was our episode on mental health services that are available, and our guest was Amna Khan, a registered psychotherapist with the Center for Healing Minds. Thank you.